There will be patients that you have that have such severe disease that they will need more than just instillations 3 to 5 times a week in the office, maybe needing it at least daily, but up to 3 times per day. And I'd like to go over the instructions that we give patients when we are doing this. I have here Jeannie, who is a patient who has rather intense symptoms in her bladder and severe pain. She has been getting regular treatments in the office, but now is ready to have them done at home because she does need them at least every day. So Jeannie, a couple issues here. We've talked about this before, but you used to drink a lot of water and always carried a water bottle. And I asked you to cut back on that. Have you been able to do that?
Yes,
to some degree? And this is important because if she's drinking a lot of fluids and putting out 2.5 to 3 quarts a day of urine, she'll dilute up the medication so quickly with that brisk diuresis that it won't be very effective. So we have her now, and it took a little while, but we have her now we have her so she's not drinking as much fluid and she should be good for the installations. Now when does the pain bother you most? During the day, when you're working, or at night when you go to bed?
It's continuous, the pain.
So we have a couple options here. You can start out with once-a-day therapy. Would you rather sleep better and use it at bedtime, or would you rather use it in the morning?
I'd rather use it in the morning.
Okay, and that's fine. Some patients will want to have it at bedtime, and some patients will want to have it both times or more. So how often we use the medication will depend on how long the drugs are acting when she uses a dose. So typically when you have a dose here in the clinic, how long does it usually last for you?
Approximately 6 to 8 hours.
And that's good because she wants to use it in the morning, and so that'll give her most of the day when she doesn't have symptoms. And so I think that what I'd like to show you is here's the medication. Now, the other thing you do is you draw a little air back in it, so when you're instilling it into your bladder, you put the catheter in the bladder, and then the last thing you push in is the air, and then you're all done. Now, how long to leave it in, it depends on how much discomfort you have with the process or whatever, but 30 minutes is what you need to leave it in to get good anesthetic effect. Mm-hmm. If you're comfortable, leave it in for an hour or 2 or 3. And then if you want to progress to using it more often, we'll wait and see how you do. If you want one at bedtime, you can do a second dose at bedtime.
That's wonderful.
Okay.
That was very easy to insert.
Good. Any other questions?
Yes, how long do I keep using the medication?
Well, we'll keep using this until your symptoms are really a lot better, and then we'll back you off slowly, reducing the number of times that you instill it every day and every week.
And how long should I stay on the Elmron?
You should stay on the Elmron forever. Don't stop that until I tell you. It's important that you continue the Elmron while you're taking this, because our goal is to get you off the catheter and only on the oral medication, so it's a lot easier for you to treat the disease and a lot easier to take a pill than to use the catheter.
Thank you.